So, Yuan Liu,
Yes.
welcome.
Thank you so much for having me.
Well, thank you for your time. We were doing an interview with Belinda Fettke
Yes.
yesterday, in fact, and she knew we were coming back to Melbourne, and she said, you have to speak to Yuan. So we reached out to you and you came at the moment's notice, so thank you so much for that.
Absolutely. It's an honor.
I think what's exciting for me, having especially been speaking with Gary, and I'm being the orthopedic surgeon,
Yes.
and we were talking about it a bit earlier at supper, was that the doctors, even if they believe in it and they tell their patient that they should be going low carb, they've got 15 minutes.
Correct.
How do they, the only way that they can get their patient to actually implement it is to have somewhere that they can send them to.
Correct.
And that means a dietitian. Okay, so I think let's just start with, you're a dietitian
Yes.
in Australia. So let's start with your story about how you ended up being low carb, because that's not typical of your training.
Yeah,
And then talk a
absolutely.
little bit later about the difficulties in terms of
Look,
the
absolutely.
legislation in that.
Absolutely. So I graduated from university in December 2008. So I became fully accredited as a dietitian in 2009. And the way we were trained, there was a huge clinical focus. So there was a huge focus on getting a job in a hospital. And when I graduated, there was only so many graduate positions available at hospitals, and everybody was competing to get a graduate position. And I was not particularly strong in my interview, nor was I particularly strong in my cover letter writing. And to be honest, I ended up with a very good opportunity in Hobart, in Tasmania, where you just
Where I've
met.
just been, right?
Yeah, exactly right. Where you came from. And I experienced a really, vast amount in the hospitals there, where I was on the stroke unit. I was also on the rehabilitation unit, so I got to see quite a fair few patients, because on the stroke unit and the rehab unit, dietitians were seen as blanket referrals, which meant every single patient that came into those wards was seen by a dietitian. So I got a lot of exposure in that setting. But when I was doing that work, it really made me go, I don't enjoy it as much as I think I should be enjoying my work, because everyone was a bed number, it was a room number. Dietitians were usually called in last minute, or when the patient first arrives, and we have to calculate fees. And then at the very end, before they get discharged, we get called in to give them some A4 pamphlets and education materials on essentially what they need to do when they go home. But there was a very limited amount of time for proper education. And what I found was I felt extremely unuseful.
Okay.
And in that setting, as a dietitian, I didn't want to feel like I was unuseful, because what lands people in the hospital with a stroke is, a lot of it now we know, is dietary. And I had no power in that setting to do anything that was going to change that. So essentially, I wanted to prevent people from landing in the hospital in the first place, and I couldn't do that. Whilst I was there doing hospital work Monday to Friday, I was then flying back to Melbourne on the weekends to do private practice, because ultimately that's where I wanted to end up, in private practice. And I had so much more control in that environment, and I enjoyed it so much more. And so ultimately I gave up the work in the hospital and focused 100% on private practice. It wasn't an easy journey the whole way through. I was very much trained as a clinical guidelines practicing dietitian, and when you're straight out of the uni gates and you're thrown into a situation in private practice, you don't have much choice except to regurgitate what you've been taught.
Right.
So for a long time, that was what I did. But even whilst I was doing that, I started to realise there was a lot of inconsistencies in even what I was hearing come out of my own mouth. So I was hearing myself say to diabetics that they needed to have more carbohydrates than they came in with. And yes, it was low GI, but it was a lot more than they had. And it didn't make sense to me. So over time, what I found myself doing was I started to reduce their carb intake naturally. And we had great results. And I went, maybe there's something in this. Maybe I've actually found a way to actually reduce their blood sugar levels.
Right.
But then I started getting clients come back saying, I'm hungry all the time. I'm, constantly feeling like my energy levels are lower than they used to be. What do I need to do? At this point, I was still obviously very fearful of recommending fats. So fats were still kept very, very low. So that, in hindsight, now I know was what was making them feel hungry and what was making them feel low energy. But what I did at the time was I increased protein. And that was a good little Band-Aid solution at the time, where they felt fuller, they felt a bit more energetic, but it wasn't actually solving anything long term. But that started to spark me to realise that the current guidelines needed a lot of change. I just didn't know where that change needed to be. Then fast forward, I mean, I was 13 years old when I was diagnosed with polycystic ovarian syndrome, and then a few years later I was diagnosed with endometriosis. And in both my diagnoses I had really painful periods, really, really painful, and every single doctor that I had ever seen was saying, you can manage it using birth control pills. There is no other way you can manage it. There is nothing you can do otherwise to change the situation. And I really just believed that. And so what had happened was I started to really pick up training. So I was doing a lot of aerial acrobatics at the time, really loved it. And I felt like I wanted to change the way my body was. I always understood that there's a term that we call skinny fat, or toffee, which is the thin on the outside but fat on the inside, and I was aware of that situation being quite prevalent amongst a lot of Asian females. And so I was really into training, trying to get more muscular, a lot leaner. And with the training, I started to intuitively change the way I personally ate. And I found myself, I mean, now thinking back, at one point my breakfast consisted of 6 eggs, and I had a whole avocado with that. I had tomato, I had spinach, and I had half a sweet potato with that. And then at lunchtime I would have pretty much chicken. It was chicken breast, so it wasn't, it wasn't a fatty cut of chicken, but it was chicken, and I had it with a salad, or meat, red meat with salad. It was still lean meats at the time, but I had avocado, and I poured a lot of olive oil through it. And I had then for dinner the same thing, but with some sweet potato. And I felt amazing. My energy levels were through the roof. I was training a lot, and it was supporting my training. My body composition was changing, my physique was changing. I was feeling great. And that was great, except at around that time, I injured both of my shoulders. But at the same time, when I was taking a little bit of a break from training, I met my partner.
Right.
So my now husband. And when you first meet someone, you go out, you eat more, you eat the wrong types of foods, you drink more, you're relaxed. And I found that I had gained 8 kilos in 8 months. And on my frame, it wasn't noticeable to other people, but my clothes were sitting tight and I felt really uncomfortable all around this area, which was what a lot of my clients were complaining about when they came in for weight issues. It was all just this area that they complained about. And I thought, oh, damn it, I've got to make some changes. So what do? I put myself on a calorie-restricted, low-fat diet. And it was genius, wasn't it? Because it was what I taught my clients to do. And up until that point, I had never been on a diet before. So for me, I was like, all right, I'll do this and I'll get myself back, and then I can go back to doing what I was doing. Lo and behold, my energy levels fell through the floor. My weight kept climbing. And not only that, I had my endometriosis pain come back. And it was really bad. Every single day I was in pain. When I was consulting, I was in pain. Obviously, when you're with someone, you're talking to people, you try to ignore it. But when you're by yourself, say driving to and from work, it was just so pronounced. It was very distracting and very debilitating. And then I thought to myself, hang on, this doesn't seem right. Why is it that I actually felt fine? Because having that episode prompted me to realize that when I was eating the way I was when I was training, I didn't have pain and I felt amazing. So what exactly is it then that I've done differently now that is causing this pain to come back? And I started to realize that even though I was told that nutrition had nothing to do with my conditions, something compelled me, I had to look into it. So I did. And the further I looked into it, I discovered obviously insulin resistance, and I discovered hormones and estrogen dominance, and I started to really dig deeper and deeper, and it became this rabbit hole that I was digging into. And then I discovered low carb and ketogenic nutrition, and I was wanting to try it. I was really open-minded and wanting to give it a go, and I did, except I was still very, very skeptical about the fats, especially saturated fats, right? Especially meats and meat fats and butters and creams. So then I realised, as I was formulating my new diet plan according to low carb, hang on a second, this is how I ate when I was training. Just maybe without the sweet potato, but this is very much that. And I started eating this way. My symptoms went away, my energy levels restored, my weight went back down, I felt amazing. And then I went, there is really something in this. So I started using this with my clients in an abridged version. It was, all the fats were avocados and olive oils, and fish. But as I became a lot more confident, because I started to see the results, and as I started to read further and further into the literature, I became a lot more comfortable with recommending saturated fats as well. Around the same time was when I suggested to my partner, who has Crohn's disease and has had Crohn's disease since he was 16 years old. I know, and he has had 2 bowel resections, 6 strictoplasty. He's been in and out of the doctor's surgery for years. And he has been told that nutrition has nothing to do with it as well. It's aggravating.
It's mind-boggling.
It is. And so when he was told all of this stuff, and when he was in his depth of his flare-up and had seen a dietitian in the hospital, they gave him Sustagen, and it made him violently ill. He was vomiting and throwing up everywhere. So his memory of a dietitian was not a great memory. And so when I said, hey, Sean, listen to me, I can help you, he said, nope, I'm not going to do anything you say. The last time I listened to a dietitian, I was violently ill. I don't want to do it.
Badly.
Exactly. Regretted it really badly. And so it was 3 years that he just kept not listening, didn't want to really do anything about it, because he was convinced that nutrition had nothing to do with his condition. Until it got to a point where he was so inflamed and he was so overweight at that point, he was just feeling miserable. Not only that, he also fell into depression as well. And so he was just a mess, and he didn't like the way he was. So he said, all right, you know what? I'm willing to give it a go. Let's just do something. And what we found was that in that time that he started, in fact, it's been now 2 years, but most of this happened within the first 12 months, he lost 25 kilos.
Okay, and that's like 55 pounds, right?
Yes,
for
correct.
Americans listening.
Yeah, it's more than 50 pounds, over 50 pounds. And on top of losing that weight, his inflammation marker, so his CRP, restored down to 5, and this all happened in the absence of medication. So he was able to get his inflammation, a condition that was characteristic of an autoimmune inflammatory bowel, he was able to get that under control with nutrition only.
Yeah, and the doctor told him never.
And the doctor told him that that was not even a possibility. So for him, his belief system became so ingrained as well. And because I witnessed that, I witnessed what happened to myself. But that was an N=1. But then I saw it in him, and that just cemented my belief. Plus everything I was doing with my clients at the time, and all the great client results I was getting, and all the literature I was reading, it just cemented my belief in low-carb nutrition. And that was really my turning point. So some would say that my turning point was not soon enough, but my turning point happened around that sort of 3 to 5 years ago from now. And since then, we've been really vocal about low-carb nutrition in our practice, and we've seen some amazing results, and the practice and utilisation of it has been quite broad. And we were talking about this earlier in supper as well, where there is literally not a single chronic condition out there that would be made worse with a low-carb diet. If anything, it would be made a lot better, if not treated.
But the thing is, he was saying, like, since it wouldn't be made worse, then and the results that you see are so quick.
Correct.
Why wouldn't you just try it?
Just try it. There is literally no harm in trying. Exactly.
That's awesome.
So that's what brought me to where I am now.
Yeah, that's brilliant, man. So you do like online coaching and stuff as well. I've already spoken to you about putting your name in our new database.
Yes, which is really exciting.
Right, but now unless people look in Australia, they're not going to find you right now. Your case has prompted me to go back and find out how to put an extra option in there for people to provide online coaching.
That's right.
So maybe just for everyone, just explain if they are interested in reaching out to you, how they could get hold of you.
Absolutely. So my company is Metro Dietetics, and so our website is www.metrodietetics.com.au, and all of our contact details are there, and you can fill in contact forms. We now do programs primarily because what we've recognised is that a one-off visit to anyone for long-term lifestyle and mindset change is just not enough. So we have started to create some really encompassing programs for our clients, and that's how we have started to help our clients. And on top of that, we also do, as we spoke about earlier, retreats, and we do a whole bunch of educational things as well to really help get that message out there properly.
Okay, awesome. So if anybody wants to reach out to you, they can. If they're in the States, you're able to help them.
Absolutely. We actually have a huge client database from the States at the moment.
Okay, brilliant. Well, thank you so much for the time that you were prepared to take to come and speak to us. It's awesome to get a dietitian's perspective. And maybe just before we finish, I mentioned it earlier. I know that in America, a dietitian is part of the Dietitians Association. If they then try to advocate low carb, they get into real trouble. They get struck off. They can't work. I just wanted to understand the environment for you guys and how you are able to operate within your regulatory environment.
Absolutely. Look, basically after we graduate from university, we then get accredited through a group called the Dietitians Association of Australia. So they're a privately owned organisation, and the accreditation through them allows us to call ourselves Accredited Practicing Dietitians, or APDs. Having that title is recognised by government health organisations like Medicare and a lot of private health funds as well. And so the way that works, therefore, is if you're an accredited practicing dietitian and doctors refer clients to you, they can claim a rebate either through private health or through Medicare. And so it has been ingrained in the dietitians in Australia as well that unless you are an APD, it's very hard to survive in private practice in Australia because most of the referrals come from doctors or other health professionals. And that has been a really big issue, not only for a lot of dietitians I know, but also for myself for a really long time as well, because when I started to realise that what I really believed in was not what the guidelines stated, I was still too afraid to give up my accreditation because it meant that my income would then fall to almost nothing. And so for me, the last couple of years, it's been about building myself up, my reputation, but also my business up to a point where I don't need to be part of the association. But really what I've endured in the last few years is I've been audited several times just out of the blue. I've had complaints made against me on several occasions, and I've had my accreditation threatened to be stripped from me as well. And it hasn't been easy because I now know we do have a limelight on us, a spotlight on us. But for me, I have a choice at the moment, and the choice is I can exit the DA if I choose to, and my business will survive, or I can choose to stay. But my decision has been to stay because I think I owe it to the industry to actually make a fight from within, because ultimately I feel that dietitians are the ones who can start to spread that message properly and to really help. Like you said, doctors only have 15 minutes with clients. Once they're done, they have to have someone to refer to. And dietitians are great people to refer to. But right now in the dietitian toolbox, low carb and keto isn't in there. And I want to help them realise that that can be a really valuable tool that they can add in there amongst all the other tools that they have. And so what we are trying to do now in our business is create an excellence program for dietitians where they can add those tools into their toolbox and then help these dietitians understand how to develop viable businesses to be able to then have that choice of either staying or exiting, because that's the thing that's holding them back at the moment.
Yeah, no, that's amazing. I was speaking with Gary of this whole weekend that we spent with him. The people that are making a stand, Tim Noakes, him, Marianne Damasi in Sydney is being attacked now as well, and then the list goes on, and you, one of those too. It takes a lot of courage to stand up for something like that, because you're putting your business and your life, at least in terms of your career, at risk. So I really, I think we all appreciate that effort, because you guys making the stand is going to make it easier for the next person who would like, and more and more people are going to come out of that box and be able to think, okay, I believe this, but I've been teaching the party line.
Yes.
And now that I see that Yuan is actually stood up for it, and she's succeeded and been successful in defending herself, that hey, maybe I've got the courage to do that too.
And that's it. It's that strength and safety in numbers theory, and I think that the more that people see that it's not so scary and you can make it happen, the more people will stand behind that movement, and before you know it, there will be a lot of dietitians who are standing out, shouting from the rooftop what they actually believe in and not fearing, and that's what we really need.
And at that point, then that threat against those people's careers goes away.
Correct.
So awesome.
Fantastic.
Thank you very much for your time.
Thank you so much for having me.
I really look forward to the collaboration. I think there's going to be a lot going on.
I think so as well.
We're even talking about retreats in Tasmania next year and all sorts of stuff.
I'm super excited about that. It will be fantastic.
Still early days, but that should be awesome.
Absolutely. Thank you so much for having me.
All right. Thanks.